Welcome to Generation Next. I am Chikere Thomas. The theme of today's segment is infertility and women's mental health. Joining me in studio today is counseling psychologist Mrs. Brenda Roach. Welcome, Brenda.
Thank you for having me.
Before we begin the discussion, let's perhaps set the tone by identifying to our viewers exactly what is infertility.
Well, basically, infertility is failure to conceive a child after having numerous attempts at unprotected sex.
Okay, so I know in the Caribbean there is a tendency to attribute infertility to women. Who experience infertility?
I'm glad that you mentioned that because there is a view that infertility is mainly with women. However, men experience infertility, women experience infertility, and couples experience infertility. Okay. So it encompasses all of us. Really.
Okay, so it's not just females?
No.
Okay. But for today's segment, we'll be talking about women in particular experiencing infertility.
Okay.
Okay, so we understand that what is infertility. What are some of the causes of infertility? How does infertility occur?
Okay, so we're speaking about women. So if we look at women in today's society, age could be a factor. Okay. Because, you know, women these days are making sure they have their careers first before they plan a family. Mm-hmm, mm-hmm. They want to make sure that they are comfortable where they're at. Right. Then there is fibroids. Okay. Now, African women especially are more susceptible to fibroids than any other ethnicity. Okay. So fibroids is another factor that can cause infertility. And those are little tumors that will grow in a woman's uterus. Okay. That can essentially either block the fallopian tubes or some aspect of the fertility process. Okay, okay. Then there is endometriosis.
I've heard about this.
Right. Now that is a concept that many people in the Caribbean are not really too familiar with. Mm-hmm. It's basically women who experience it that understand more about it, right? Okay. So this is a painful disorder in which the tissue lining of the uterus comes off. And it can, as similar to fibroids, it can block the fallopian tubes. It can cause very painful menstrual cycles for women. Yes.
Wow. And I've also heard about polycystic ovaries.
Yes.
Is that another cause for infertility?
Yes, that can be because polycystic ovaries is really hormone levels. So when a woman has more male hormones within their system, then it can cause them to skip a menstrual cycle, which then makes it difficult to become pregnant.
To conceive. Mm-hmm. Wow. So there are definitely a lot of contributing factors for infertility. Yeah. And, you know, in our Caribbean society, there is, you know, a sort of expectation that, you know, eventually a woman should progress to have kids. Mm-hmm. To raise kids. I can only imagine that it can be very painful for a woman who gets a diagnosis of infertility, emotionally that is. Mm-hmm. What are some of the psychological symptoms a woman may experience as a result of, you know, having a diagnosis of infertility?
Now that is very important because I think, especially within the Caribbean, that we're not really sensitized to that issue. That it can have a psychological effect on a woman. So, for instance, anger can be one of the psychological symptoms that a woman can experience. Okay. You know, every time she passes a pregnant woman on the road, that can trigger some anger in her. Yeah. And it's not intentional. Frustration. Yes. It's not intentional, but it is something that would happen. You know, it's normal. Feeling shame.
Why shame?
Shame because, as you said, in society, and I guess too in our culture, the way we were socialized. So we were socialized with women having defining roles within society. So growing up, we would have seen our parents, our mothers really, so they would have been mothers, they would have been in the kitchen preparing foods and stuff like that. You know, being the nurturers of the family. So then for a woman not being able to reproduce herself, that can cause some shame on her. She can begin to feel shame.
Yeah, and you know, you're talking about societal expectation, and I'm thinking shame in terms of also, you know, some of the activities persons may engage in. For example, a young couple who just got married, you know, society may induce shame just by the things they say in terms of, you know, we have this common thing. So when I'm getting a grandchild, when we can expect a child, and because of that, you know, and the feelings of, you know, feeling defective or unworthy, we may begin to feel shame, experience shame as well. Is that correct?
That is correct, yes.
Okay.
That is correct.
Okay.
And then, of course, I mean, we can get back to the shame and stuff, but still with the symptoms,
Yes.
there's anxiety as well.
Yes.
So when every month a woman might see a menstrual cycle every month, and then that's a constant reminder, well, hey, I wasn't able to conceive this month.
I failed.
Yeah, I failed. And then the unworthiness, as you said,
Yes.
comes into play there as well.
So in a sense, the menstrual cycle actually becomes symbolic now with this feeling of failure, because it means to say, I was not successful in conceiving.
Yes.
Oh, wow.
And
so there's quite a lot of emotional problems or challenges someone would experience.
Yes.
Is there any other?
I was going back to when you were speaking about the failure and the constant reminder then with the menstrual cycle.
Yes.
And then, of course, then that would raise stress levels. So we can look at stress.
Yeah.
And then, of course, once you are stressed, it can bring on a menstrual cycle as well,
Yes.
which can then cause you not to be able to conceive, because that is just, it's on your mind constantly.
Wow.
You're seeing it in your face constantly. Or, as you said, people in society, they approach you and they would say, when are you going to get pregnant? When are you starting a family? Especially,
Yes.
as you said, when you're newly married.
Yes.
That's
Yes.
the first thing that everybody thinks about.
Yes.
So, yeah.
Wow. So what about in terms of the cohabitating relationship? And you know, earlier on we talked about who experience infertility. So we know it's also males as well as females. So in terms of the cohabitating relationship, are there instances of blame and guilt that may be experienced among the couple?
Yes, I'm glad you raised that, because yes, that is true. Some people, some women, because we're dealing with women mostly here.
Yes.
And some women, okay, even though they may be trying to get pregnant and then they're not seeing it happening,
Yeah.
they may be afraid to go and seek medical attention, to go
Fear.
and, fear. So, because they may not want to know what the outcome will be. So, for instance, they may think, okay, well, it may be me, because that's what society portrays for us to
Yes,
think, that
yes.
it's the female.
The female.
And then comes the resentment can come up
Yeah.
within a relationship.
Yes, yes.
So even if the female may not think that it's her, it may be the male,
Yes.
then they can begin to resent the male in their lives,
Wow.
because they may think, okay, well, maybe it's your fault and not my fault. So then the blame comes into play, and then of course that causes a disintegration of the relationship.
I can
you know?
imagine.
Yeah.
Quite a bit of strain in the relationship. So this is quite a lot.
It is.
For someone to handle, you know. And we talked about the emotion. What about how these emotions may be manifested through behavior? What are some of the behavior that we may see as a result of these emotions?
So some of the behaviors, avoidance is one. So for instance, you know, in the Caribbean we have a lot of gatherings, and we like to share, when things are going well, we like to share with friends, family, everyone. So for instance, there are baby showers. People within your age range may be pregnant at the time, and they're having baby showers left, right, and center, and you feeling left out because, you know, you're not able to conceive.
Yes.
So avoidance can come into play there, where, you know, you decide you would make up an excuse and say, well, I can't attend, or I'm not going because I don't want to be there to see
Yes. Yes.
and experience, and then how I feel when I experience.
Let me just take a pin there as we're talking about that avoidance. I'm wondering, some persons may interpret that as, you know, as being selfish. Is that okay for someone to, you know, to do, or, you know, as a result of, you know, trying to avoid some of the embarrassment, the topics that may make us feel uncomfortable? Do you think that is selfish? Is that okay?
I think for the individual, it's okay.
Yeah.
It's okay to be selfish sometimes.
Yeah.
I mean, we can't always think about others all the time,
Yes.
can we? We have to
Yes.
think about ourselves and our well-being. And sometimes, in order to protect ourselves, we have to be a little selfish at times. Others looking on from the outside may think it's selfish too.
Yeah.
And some may voice it, some may not voice it. But I think it's up to the individual themselves and how they feel about themselves. If you need to be selfish, because
Yeah.
everybody doesn't understand what it is that you're going through or what you're experiencing at the time.
So it's basically, you know, just trying to safeguard ourselves from
Protect
triggers.
ourselves.
So being aware of our surroundings. So until that person is okay and come to terms with some of their situation, avoidance can be acceptable.
Yes. Until they are comfortable,
Yeah.
then yes, avoidance is acceptable.
Yeah.
So secrecy. So that's another thing that I think happens more so in the Caribbean in terms of, well, before we would have mentioned stuff like endometriosis and
Yes.
fibroids.
Yes.
Now, a lot of people will be familiar with the fibroid situation. The endometriosis, now, on the other hand, people are not too familiar with. So it's kind of like a secret that some women carry with them. It's a hidden something. So unless people can see it on the outside, on the physical,
Yes.
then they don't really understand
Yes.
what's
Yes.
happening on the inside.
A sort of hidden wound.
Yes, so it's
Yes.
a hidden wound that some women do carry with
Yes,
them. So
yes.
secrecy, it becomes secret, where each month, if a woman is experiencing something like this,
Yeah.
and they don't know how to express it to somebody else because they feel that, you know, they might not understand,
Yes.
then it becomes a secret and you feel isolated.
Yes.
So that's another behavior that can be as a result of the symptom.
And you know, rightfully so. I think there's so much stigma. On the whole, sex and reproductive health is still very much taboo in our Caribbean space, and I can really see how secrecy can become an option for persons who are experiencing infertility, because not everyone knows how to respond. Not everyone knows how to, you know, how it will be received, you know, because the expectation is so great. You know, motherhood, you know, being tied in a sense to womanhood, you know. So I could see how secrecy can definitely become an option.
Yeah.
Okay. Are there any other?
Withdrawal can be
Withdrawal.
another behavior. In terms of, for example, church. A lot of us in the Caribbean are religious.
Yes.
So we go to church. That's another social gathering,
Yes.
I would say. And when there are functions such as Mother's Day, you know, Mother's Day is really publicized all over the world.
Yes.
But in the Caribbean too as well. And we make a big production of Mother's Day. And so for those women out there who are not mothers, what does that say to them? There are women who are mothers but not biologically so.
Yes.
So I think that we need to include, there needs to be more inclusion.
Yes. Yes.
In terms of when we say Happy Mother's Day to mothers, it can include all women, because we all play a role at some point in time in our lives in either being an auntie, a godparent, anything. And so some women would stay home from church then, because at church you tend to have, whether they put on a brooch or something, on a, you know, they have all mothers stand up, they say a prayer for mothers, or they may have a breakfast, something for mothers.
Yes.
So, you know, withdrawal is another behavior that can be exhibited as part of the symptom.
Wow. So it really does call for our society to become more sensitive, you know, some sensitization surrounding infertility and how women are affected emotionally, and how us as individuals may induce or trigger some of these emotions, these negative emotions that may impact upon a woman. you mentioned, you know, some of the gatherings that happen in the church scenario, and it reminded me of Mother's Day 2017, and someone sent a message, a WhatsApp message to me, and it was so inclusive. You know, it talked about, you know, persons who actually gave birth as well as those mother figures, so an aunt, a teacher, and I found that was, you know, really commendable, because there are persons out there in our roles, whether it be teachers, maybe a psychologist, you know, auntie, a godmother, we do help to, you know, nurture and you know, and raise children.
Exactly.
Yeah.
So inclusion.
Yeah.
Just make sure that everybody is included when we speak about mothers.
Yes.
Yeah, so that then people don't feel so ostracized. Women don't feel so ostracized from society.
This is wonderful, Brenda. So, for someone who is listening to our program today, what are some of the options that are available to a woman who may be, you know, struggling with infertility, or may have or experience challenges with infertility? What are some of the options available to that woman?
So first, I would say, speak with your doctor, your normal GP, or an actual gynecologist if you have one, because then your GP can actually refer you to a gynecologist who would have more experience in infertility issues.
Yes.
So that would probably be the first step. Or should I say the first step might be just to speak with your partner who you live with, or a friend, family member, whoever you feel comfortable speaking with.
Yes.
And then go to your GP or your gynecologist and let them do some investigations first to see what may be triggering the infertility. It may be something simple that you may need an out-of-office procedure that can fix that. Other than that, there is surgery. So remember, we would have spoken about the fibroids.
Yes.
So there's surgery to remove fibroids. That will then help to increase your chances.
Okay.
There's surgery to remove the endometriosis tissue as well. That can also increase your chances.
Okay.
Of course, with both options, the issues do come back. So the fibroids do grow back, the endometriosis does come back. But at least it gives you a window of opportunity in there that you may be able to reproduce, if that's the option.
Okay.
There's also the IUI, which is, I'm going to read it because I'm not a medical doctor. So
yes, and for our viewers, we just want to just, you know, reiterate that Mrs. Roach is a counseling psychologist. So you're just talking from as best as you know, and based on the research that you would have done, as well, and the population that you work with. So that's fine. Okay.
So the IUI is intrauterine insemination. And this is where the semen is deposited directly into the uterus to give the woman more chance of being able to reproduce.
Okay, okay.
There's also IVF, which is the in vitro fertilization, which is a little bit more costly than the IUI. So the IUI is a little cheaper.
Okay.
According to research.
In terms of dollars and cents, what will those two procedures look like?
So the IUI would look at around between $750 Barbados dollars to $1,000 Barbados dollars.
Okay, okay.
The IVF now, because this is, you're removing eggs from the woman's uterus.
Okay.
You'd remove the eggs, and then you would implant the semen into the egg, fertilize it on the outside, and then insert it back into the uterus.
Okay.
So that one is more costly, and that's around $20,000 Barbados dollars.
It sounds more complicated.
Yes,
also.
so it's more complicated.
Okay, okay.
Yeah. Then, so both of those procedures, the IUI and the IVF, they can be conducted at, there's a fertility center here in Barbados.
Okay.
Yes. So that's in Worthing, I believe it is.
Okay.
Yes, so that's there. And then there's also one from when I was doing my research, there was one located in Trinidad.
Yes.
So there's the Trinidad and Tobago IVF and Fertility Center.
Okay.
So those are the two that I know about within the Caribbean.
Okay.
Of course, there are many more, you know, internationally, if you care to do that.
Yes.
Yeah?
So you mentioned medical procedure. First, so I know many persons may be struggling financially and may not, you know, be able to, you know, invest in one of those medical procedures because of constraints. What are some other options available?
So there's adoption,
Okay.
if you care to consider adoption. I know that too is kind of taboo within the Caribbean. Everybody is not open to adoption.
Yeah.
But adoption happens here in Barbados through the Child Care Board.
Okay.
And the process takes about 13 months, so a
Okay.
little over a year.
Okay. Okay.
And you get to go, you can even meet the child and everything before.
Okay.
And then, so adoption is an option.
It's
It's
an
just that it
option.
would not be your biological child. But every child needs love in some way.
That is
And
true.
if you want to be a parent, then that is an option that you can take.
That is true. And I'm happy you mentioned about sometimes the fear of adoption. And especially I've seen, in my personal space as well, in terms of males and their perception of adoption, wanting to, bring in or birth a child that, I am a part of, as opposed to, raising someone else's child or offspring. So that's definitely a challenge. But as you mentioned, kids who are probably in residential care facility or even in foster care arrangement, they do need love, they do need parenting, and that is definitely an option to explore as well.
Yes.
Okay. In terms, any others for a woman who may be, just need help in processing all these emotions, trying to find a safe space, because we talked about earlier, talking to someone, but not everyone may, be able to deal with that particular topic or respond the way that may be helpful, and it may actually induce more harm than good. What are some of the options in terms of, talking through and processing, just navigating through that process of infertility and all the emotions that come with it? What are some of the options available?
And I'm glad that you mentioned that, because as you can imagine, this can be a very traumatic experience for a woman.
Yeah.
It's very emotional, and having that support there is really necessary. Some women are single and prefer to have a child by themselves,
Yes.
and that's fine as well.
Yes.
So therefore they would need that support. If you don't have the family support,
Yes.
then it would be good to have some kind of support system there in place for you. And that's where I would speak about therapy. I believe that psychological intervention can be useful, can be
Yes.
beneficial
Yes.
for a woman who's experiencing anything like this. And it gives the woman a chance to explore how she feels, her thoughts,
Yes.
her feelings, her beliefs. Because as we would have mentioned before, culture plays a huge part in how we process our information, learn
Yes.
behaviors, and watching what our mothers would have done before us. So therefore being able to explore these feelings, thoughts, and beliefs in therapy
Yes. Yes.
would be very beneficial to a woman. It's in a safe, empathetic environment
Yes.
that a woman can feel comfortable opening up and talking and sharing. I mean, some women may prefer to go to a male psychologist. That's fine,
Yes.
if that's where you feel comfortable.
Yes.
Or speaking with another female who may know of some of the experiences that they may be going through, that would be beneficial as well.
And I think that is very important, because you want a space where your feelings can be validated, and it's okay to feel or experience these emotions, because very often some persons may be inclined to trivialize how that person may be feeling. For instance, there's usually some saying, well, you have a PhD, what you want with a child, or you have a good husband, things are going good for you, but I still desire, that woman still desire to conceive, to experience childbirth, and it's okay to feel these emotions, So really having a safe space and really handpicking who you tell your story to is important.
It is very important. And then the psychologist can go through the options with you. So you can discuss whatever options your gynecologist would have given you with your psychologist.
Yes.
Work through that process, and even what some of the outcomes may be. So, for instance, if you try this route and it doesn't work that through with the psychologist to help you and to give you a better understanding of what is to come. And to also help you to realize that, you know, you can have a fulfilling life even if you don't have a child.
Yes.
But
yes.
just to help you work through that process, I think is necessary.
I definitely want to, you know, encourage women out there to really reach out to some of these psychologists, who are located in their area. And of course, Ms. Roach has extended an invitation as well. So I do want to thank you so much, Brenda, for joining us on UWI TV. I think this topic is really, really relevant to our Caribbean space, and not just the Caribbean space, but for persons in the diaspora as well. I believe we would have definitely benefit from the discussion, especially in terms of you know, looking at some of the myths surrounding infertility, you know, and, you know, also what are some of the options, you know, what are some of the causes of infertility. So I think it was really an enriching conversation that we had today, and I thank you so much for joining us on UWI TV. Any closing remarks?
Well, as I would have mentioned, this is a passionate topic, and I think it was really a good topic to bring to the community, to wherever this is going to be broadcasted. I think, as we would have mentioned before, sensitivity is really what is needed. I think once people are more open to the concepts that we would have shared today, I think then a greater understanding will be had by all. And just knowing, for women to know that there are people out there that they can talk to, that they can come to, and share their feelings, their thoughts, and know that they are not abnormal in any way, that they are still fulfilled and rich, they can lead rich and fulfilling lives, that's important.
Thank you, Brenda. So we will remain mindful of you know, really being sensitive and some of the emotional turmoil that a woman may experience. So in our discussions, in our conversations, in our homes, in our community, let's continue to be sensitive of this issue.
Yes.
So thank you, Brenda, once again on behalf of UWI TV. Thank you for joining us on UWI TV. I am Chikere Thomas, and today we had in studio counseling psychologist Brenda Roach. Thank you for joining us.
Thank you for watching. We hope you enjoyed this program. Remember, you can watch this and all our programs on our website, www.uwitv.org, available anytime, anywhere, and on any device. Also, join the conversation on social media by visiting our Facebook, Twitter, and Instagram pages.